Welcome back to part 9 of our Dental Coding Masterclass Explainer series. Now, if you hung out with us for part 8, you know we completely conquered diagnostic dental terminology. Today, we're going to take that foundation and focus entirely on the core procedural definitions, plus those essential dental chart abbreviations that every single coder needs to recognize instantly. Here's a quick look at our roadmap for today. We'll kick things off with decoding the dental chart, move into core procedural terminology, hit diagnostic chart abbreviations, tackle common treatment shorthand, and then wrap it all up with our coding and audit takeaways. Let's dive right in. Section 1. Decoding the dental chart. Okay, we're starting with a massive, everyday problem that coders face literally every single day. Translating those messy, shorthand-filled provider notes into clean, compliant codes. Mastering this terminology isn't just some academic exercise. It is your ultimate defense against audit failures. Because, let's face it, misinterpreted provider shorthand directly risks denied claims, compliance failures, and ultimately lost revenue. When a dentist is moving fast and writing quickly in a chart, it is our job to translate that into exactly what happened in the chair. Section 2. Core Procedural Terminology. Let's start building that rock-solid coding foundation with our first core term, prophylaxis. You are going to see this one constantly. Think of this as the baseline reset. It's the foundational professional cleaning to remove plaque, calculus, and tartar before bigger issues even have a chance to arise. It really is the absolute baseline of professional preventive dental care. Now, moving a bit deeper into the supporting structures, we have periodontics. This deals directly with the gums and the alveolar bone that actually hold the teeth in place. As a coder, you're going to see procedures like scaling and root planing feature prominently here. Those are the deep cleanings performed below the gum line to remove hardened plaque and tartar. Next up is endodontics, and this takes us right inside the tooth to treat the dental pulp, which contains all the nerves and blood vessels. When you see this term, I want you to immediately think of treatments like root canal therapy, where the clinical focus is strictly on the internal root canal system of the tooth. Now, this is a distinction that trips up a lot of folks, but it beautifully illustrates the difference between two often confused procedures. A pulpotomy removes pulp tissue strictly from the crown portion of a tooth. In sharp contrast, an apicoectomy is a minor surgical dental procedure used to treat persistent infections right at the root apex. Knowing the difference between treating the upper crown portion versus surgically addressing that bottom root tip is absolutely vital for accurate coding. Taking a look here, notice how a replacement crown acts as a full coverage cap. It fits perfectly over a reshaped tooth to restore its shape, size, and its overall strength. This is a major restoration, which is quite different from your standard dental filling that simply repairs a smaller portion of the tooth structure damaged by decay or trauma using amalgam or composite resin. Before we officially leave terminology behind, let's fire off a few key preventative terms that bundle into the D1000 through D1999 CDT series. We have sealants, which are thin, protective coatings applied to the chewing surfaces of those back molars. Then there's fluoride treatment, which actively strengthens the enamel and prevents decay. We also have oral hygiene instructions, or OHI, which is that one-on-one personalized education. And finally, preventative resin restorations, or PRR for short, which is a really conservative treatment that beautifully combines sealants and composite resin. Section 3. Diagnostic chart abbreviations. All right, let's put our auditor's lens on for a second. Think of this as your ultimate diagnostic cheat sheet for physical wear and decay. You'll see CA used for caries or cavities and EB for abrasion. Then you get into developmental issues, where E/D stands for an enamel defect and E/H denotes enamel hypoplasia. Keeping up that rapid-fire translation, GI1 through GI3 tracks the severity of gingivitis, going from mild to severe. Meanwhile, PD1 through PD4 maps out the specific advancing stages of periodontal disease. You are also going to spot ROT for a rotated tooth, and if a patient's chart says they are edentulous, that simply means they are completely without natural teeth. Section 4. Common treatment shorthand. Now we're transitioning from what the dentist diagnoses to the shorthand for what they actually do. Knowing these abbreviations instantly is critical for rapid, compliant coding. RCT means root canal therapy. R/C stands for a resin or composite restoration, and a simple X marks a tooth extraction, meaning the complete removal of a tooth from its alveolar socket. Honestly, memorizing these speeds up your workflow tremendously.
To wrap up our daily shorthand cheat sheet, we have those super common encounter notes. OHI given means oral hygiene instructions were provided directly to the patient. NB is standard shorthand for nerve block anesthesia. And a 6M recall indicates that a routine follow-up is scheduled after 6 months.
Section 5. Coding and Audit Takeaways.
So let's tie all of this terminology directly to the financial health of the practice. Mastering these translations ensures your claims match the clinical documentation perfectly. As you can see, translating shorthand correctly prevents misinterpretation of provider notes during pre-authorizations, audits, and claim submission. Really, it's the absolute bedrock of a clean claim. And that officially wraps up our explainer for today. Next time, in Part 10 of our Masterclass series, we're going to dive deep into CDT code architecture, exploring procedure codes, nomenclature, and service categories. Please make sure to like, subscribe, and share this with your fellow coders. But before you go, I want to leave you with a quick thought. Is your practice losing revenue simply because a chart abbreviation was misread? Keep that in mind the next time you review a chart. Decode Healthcare with Harshal.